Welcome to this continuing education module for certified nursing assistants. Today, we are focusing on a critical area of resident care, assisting with the self-administration of medication. As a CNA, your role is vital in maintaining the health and independence of your residents, but it is equally important to understand the strict boundaries of your scope of practice. Assistance with self-administration is a specific legal and clinical category. It may include certain prescription medications, often referred to as legend drugs, as well as over-the-counter or OTC medications. However, there are two non-negotiable requirements before you can help. First, the medication must have been provided by a licensed pharmacy or a healthcare provider. Second, the medication must remain in its original, properly labeled container. You are never permitted to assist with medications that have been moved to secondary containers like envelopes or unmarked pillboxes. The most important concept to remember is this: the resident must remain responsible for taking the medication. As a CNA, you are the support system. You are there to facilitate the process, but you do not independently administer the drug or decide on the dosing. If the resident is not capable of participating in the process, the task may shift from assistance to administration, which requires a nurse. To ensure resident safety, assistance is limited to specific routes, or ways the medication enters the body. Let's break these down. First is the oral route. This includes tablets, capsules, and liquids taken by mouth. This is the most common form of assistance you will provide. Next is topical medication. These are creams or ointments applied directly to the skin. A critical safety rule here is that the skin must be intact. You should not be applying medications to open wounds or broken skin, unless specifically directed and trained for wound care, which often falls outside this scope. We also have transdermal patches. These are medicated adhesive patches placed on the skin to deliver a specific dose of medication through the skin and into the bloodstream. Regarding ophthalmic or eye medications, your role is limited to assistance only. This means you can help the resident steady their hand or hold the bottle, but you are not to perform the actual installation, that is, you do not squeeze the drop into the eye yourself. Otic medications or eardrops are also within the approved routes for assistance. Finally, there are nasal routes. This includes nasal sprays, metered dose inhalers for asthma or COPD, and nebulizer treatments. We will discuss the specific steps for nebulizers in a few moments. When you are asked to assist with medication, you must follow a consistent, unwavering safety process. This helps prevent medication errors and ensures the 5 rights of medication safety are met. First, retrieve the medication from its secure storage area. Never leave medications unattended on a cart or a bedside table. Second, verify the label. Confirm, triple check, that the name on the bottle matches the correct resident. Third, communication is key. Tell the resident the name of the medication and what it is for. For example, Mrs. Smith, here is your blood pressure medication. Fourth, confirm that the resident agrees it is the correct medication. This respects their rights and adds a final layer of verification. Fifth, carefully open the container and remove the exact prescribed amount. Sixth, place the medication into a medicine cup or directly into the resident's hand. Remember our professional tip: never touch the medication with your bare hands. Seventh, provide water or juice if it is appropriate for that resident's diet and the specific medication instructions. Eighth, provide physical assistance as needed, such as helping the resident lift the cup to their mouth if they have tremors or weakness. Ninth, immediately return the medication container to its secure storage. And finally, document the assistance immediately according to your facility's specific policy. If it isn't documented legally, it didn't happen. A vital safety reminder: never assist with a medication if the label is missing, torn, or illegible. If you have any doubt, stop immediately and report your concerns to your nurse or supervisor. There are certain medications that require extra attention. Let's look at nebulizer treatments. In this scenario, your role is technical but limited. You may open a pre-measured unit dose and pour it into the nebulizer cup. However, you must not adjust the medication dosage or change any of the machine's settings. Then we have PRN medications, those taken as needed. You may assist with these only under 3 specific conditions. First, the resident, or their authorized representative, must request the medication. Second, there must be clear written instructions, such as a specific dose for a measurable symptom, for example, 1 tablet for a headache. And most importantly, you cannot use independent judgment. You cannot decide whether a resident needs a PRN. They must be able to express the need themselves based on the written order. If the instructions are unclear, notify your supervisor. Depending on your specific training and your employer's policy, you may also be authorized to perform other clinical tasks. This can include checking blood glucose with a glucometer, applying or removing anti-embolism stockings, and assisting with oxygen. For oxygen and CPAP equipment, you can help place the cannula or the mask, but you must never adjust the flow rate or the machine settings. You may also measure vital signs and assist with colostomy bag care. All these tasks must follow your documented authorization and training guidelines. Understanding what you cannot do is just as important as knowing your duties. To protect your certification and resident safety, you must never calculate, mix, or compound medications. You are not permitted to prepare or give injections, nor can you administer medications through feeding tubes, IVs, or other parenteral routes. Invasive administration, such as inserting rectal, urethral, or vaginal medications, is strictly prohibited for CNAs in this role. Furthermore, you must never make decisions to change the dose, the timing, or the route of a medication. You also cannot perform irrigation or wound debridement. If a task requires nursing judgment or an invasive procedure, it is outside your scope. Period. For tablets and capsules, you may assist unless there is a specific restriction in the care plan. For liquids, accuracy is critical. Always measure at eye level, with the cup placed on a flat surface, to ensure the dose is exact. Be especially careful with enteric-coated and extended-release medications, such as MS Contin. These must never be crushed. Crushing an extended-release tablet destroys the slow-release mechanism, causing the entire dose to enter the resident's system at once. This can result in a dangerous and potentially fatal overdose. For topicals, always wear gloves and apply only to intact skin. For patches, ensure the skin is clean and dry before the resident applies it. For eye drops, remember, you are assisting the resident in handling their own bottle, not instilling the drops yourself. For suppositories, you may hand the medication to the resident, but you must not insert it. And finally, a reminder on IV medications. These are never permitted for CNA assistants. Always read the prescription label carefully. Many medications look similar or come in different forms. You must confirm the correct medication, dose, and route every single time. As we wrap up, let's review the key do's and don'ts of professional medication assistance. Always read the label every time. Encourage independence to support dignity and cognitive health. Provide fluids when appropriate to help with swallowing. And document your actions promptly and accurately. Now the do-nots. Never touch medications with your bare hands. Use a cup or gloves. Never assist with unlabeled or mystery medications. And never perform tasks that require nursing judgment. Medication assistance demands your full attention to detail, strict infection control, and a deep respect for resident rights. If you are ever unsure about a medication, a dose, or a resident's condition, follow one simple rule: stop and report. Patient safety always comes first. Thank you for your dedication to providing safe, high-quality care.